Hi, I'm Dr. David Smotrich. I'm the founder and medical director of Jolla IVF. Now I would like to talk about unusual cases. At Jolla IVF, we've been very fortunate to take care of a lot of cases from all over the world where people would consider them unusual cases. When I was in medical school, we learned about something called Rokitansky syndrome. Dr. Rokitansky discovered a group of women who were born genetically as women. They have ovaries, they had breast development, but unfortunately, when their friends at the same age were having periods, they did not have periods. And it turned out that these women were born without uteruses and frequently born with a very narrow vagina. Frequently, these young girls are diagnosed at age 13 or 14. They're diagnosed with their moms, and from a very young age, they know that they have the ability to give eggs, but they don't have the ability to carry a child. While in med school, they told me I'd never see a case like this in real life. I've already done over 100 cases of patients with Rokitansky from all over the world. In a situation with a woman born without a uterus or Rokitansky syndrome, we match that woman with a surrogate. We have the surrogate's uterus prepared, and we use medications to stimulate the ovaries of the Rokitansky patient, just like other patients who undergo IVF, whether it's an egg donor or an intended mom. Under ultrasound guidance, under anesthesia, I stick a needle through the vagina into the ovary, and we use a suction irrigation system to get eggs. And we use those eggs, the gentleman's sperm, to create embryos, and we grow embryos to be put into a gestational surrogate. Now, because I've been blessed to do over 3,500 surrogate cases, I have done many cases of patients with Rokitansky, as I mentioned, and other unusual cases where, for example, a woman has congenital abnormalities of the uterus, whether she has two uteri, whether she has only one uterine horn, Rokitansky when she's born without a uterus. We have situations of cancer patients where the uterus has been removed, but the ovaries are still intact. Tumors of the uterus, like fibroids, which require the uterus to be removed. Situations where they were exposed to chemicals in utero while they were pregnant in their mother's wombs, causing an abnormality in terms of the growth and development of the uterus. In all of these situations, we've been fortunate to take care of patients, and in those situations, getting eggs for them so they could be genetically involved in children in the future. In addition to cancer situations that a woman would lose her uterus for, there are certain blood dyscrasias that she would lose her uterus where she continually has significant bleeding causing anemia, and sometimes the uterus has to be removed. Now, people are more conservative about removing the uterus, but sometimes they go in and they do something called an electric ablation of the inside of the uterus, which removes all the endometrial tissue. And so when a woman doesn't have any endometrial tissue, the endometrium is the internal portion of the uterus, which is the place where an embryo implants and allows for a fetus to grow and develop. So if a woman has an abnormal interior part of the uterus, she benefits very well with a surrogate, and in that situation we get eggs from her, sperm from her husband, create embryos and put them into a surrogate. There's another situation of an unusual case which we've been involved with several times before, what we call post-humerus sperm, where the gentleman has passed away and then a urologist has been able to surgically remove sperm after the gentleman has passed away. And in those situations, we can use the sperm to create embryos and put the embryos into a woman to have a healthy pregnancy. And we've been very fortunate to do several cases like this. There are many practices throughout the United States that may have the technology to do this but have never done it and never done it successfully or refused to do it. Assuming that when they took the sperm from the gentleman who had already passed away, that they did all the required blood and urine testing required by the United States federal government and FDA, then that sperm indeed can be used in a case where the embryo is created, whether it's from the wife of the deceased gentleman or from eggs from an egg donor, created and could be put back into the wife or can be put back into a gestational surrogate. And while this is a very unfortunate case, In the cases that we've been involved in, this is a wonderful thing frequently for families, and we've done many cases like this in the past before.